All right. Well, for those of you who I don't know, my name is Heather Korbulik, and I am the Executive Director of the Silver State Health Insurance Exchange. And it is a very big pleasure to be with you again for our 5th annual prep session. I hope that this presentation is going to be informative and that it'll get you pumped up for Plan Year 22 and our open enrollment season, which is just a few weeks away. A couple of quick housekeeping items. We will have everyone's mic muted for this presentation. I'm hoping to cover a lot today, but it is likely that you're going to have questions. So I'll do my best to answer all of the questions either in the presentation material or at the end of our presentation. If I don't know the answer or if we don't have time to get to all of the questions, we'll follow up with a recording of this presentation and a Q&A of all the questions that were asked both today and tomorrow. And that'll be included in the email that we send out notifying you of the link where you can find this recorded presentation. We have a great crowd already, and thanks for being here. And so let's just get right into it. This morning, I want to cover quite a bit of ground. So I'm going to talk as quickly as I possibly can and make sure I get through all of this. I want to go over the exchange's mission and give you some information about our 2021 enrollment and where we've been. It's been a wild year. I also want to give you a picture of what we see as the uninsured landscape throughout the state. Then talk about Plan Year 22, give you some important dates, some information about the renewals, about open enrollment for 2022 and what you can expect to see. And then some really great information about American Rescue Plan Act. I want to give you a sneak peek to our ad campaign that was put together this year by our new vendor, the Abbey Agency. And then we'll talk about some of the challenges. Every year there's challenges for open enrollment, and this year is no different. So we'll talk about 22 challenges, and I'll give you some updates from where the state healthcare activity is, and then a call to action and for your help at the very end. So with that, let me just introduce our mission. Obviously, our mission is to make sure that more Nevadans are insured, and that's pretty basic, and that's what we always keep as our North Star here at the Exchange. But I want to make sure that everyone knows that we don't just do that because it's important for people to be insured, which it is. It's also really important to keeping a healthy citizenry and to build up our public health and make sure that our community has a solid well-being. So they're really, I mean, I said this last year, and I think it's worth saying again, because this pandemic is persistent, there really is no better time to be insured, and pandemics are a very bad time to be uninsured. So informally, our mission statement is really about helping. Insurance can be so confusing, and that's why we are so pleased to have these partnerships with all of you. Your expertise is one of the most critical components in connecting Nevadans to affordable comprehensive coverage. It helps them understand how to use their coverage, and I can't really adequately express how grateful I personally am, but I want to make sure that you all hear that the governor, Governor Sisolak, Nevada lawmakers, and the whole team at the Exchange really appreciates the work that you do. And we know you work long hours during open enrollment period, but we really appreciate the work you do to connect Nevadans and answer their questions. It's crucial, and we value your time, even though it doesn't always get a lot of attention. I know a lot of you know what the Exchange does, but I feel like it's important for me to share a little bit more information for those of you who may not be aware. The Silver State Health Insurance Exchange is the agency that owns and operates the online marketplace known as Nevada HealthLink. We connect Nevadans who are not insured by their employer, by Medicare or Medicaid, to comprehensive ACA qualified insurance. So individuals and their families can purchase ACA certified qualified health plans and qualified dental plans through the Exchange. And if they're eligible, they can receive subsidy assistance to help them pay for their monthly premium costs and sometimes other costs depending on their income. So Nevada HealthLink is the only site, and that's a really important thing for everyone to know, Nevada Health Link is the only site Nevadans can get access to financial assistance in our state. I think it's really important to note that the exchange is a self-funded state agency. We do not collect any state general funds or federal funds to support our operations. So now that you know who we are, I think it's important that we start talking about where we are and then what's coming soon. I'm going to give you a preview or a picture of where we were in 2021. So enrollment demographics for 21 at the end of our open enrollment period that ended January 15th of 2021, we had enrolled 81,903 Nevadans. And of those, about 53% were female and 46% were male. Most of those folks were between the ages of 35 to 54 years old, and a lot of them were also above 55 years old. That's a really important piece that I think a lot of you all know, that most people who are in those age brackets know that they need to be covered and generally have some health needs. But that's why we really want to grow all of these age categories, including that 18 to 34-year-olds. In 2021, at the end of open enrollment period, again, this is what would look like as of January 15th of 2021, and a lot went on, which we'll talk about after this. But in terms of the different plan selections, we had most people purchasing silver plans, so 56.7% of that 81,000 folks, or nearly 82,000 folks, were in a silver plan, which is great. That's where you get the bang for your buck. We saw a lot of people in bronze, and some in gold, and then some in the catastrophic category, but not very much, and that's just fine with us. Back in plan year 21, during open enrollment period, 44,483 consumers took action. That means that they actively came online and selected a plan, made plan changes, made updates to their applications. And then about 37,420 just let that passive renewal or that automatic renewal go through and stayed in their existing plan. We saw over 84% of those folks who were on exchange back in January were receiving advanced premium tax credits. And then about 50% of our enrollees were receiving cost sharing reductions, or those assistance with their premium or with their copays and other out-of-pocket expenses. And year over year, we've seen our enrollment fluctuate. So you can see there's been peaks and valleys, and this last year was a growth year for us, and we're hoping to continue with that momentum into plan year 2022. And I think one of the key considerations for you to know is in 2020, we became a state-based exchange. So we're actually heading into our third open enrollment period operating as a state-based exchange. And every year we get a little bit better at this and have a little bit more comfort with what we're doing and the data that we have within our system. So we've really taken the last few years to analyze that data and do what we can to target our outreach and marketing efforts, and to make sure that we're really kind of covering the uninsured population and making sure we're targeting those folks. So it won't come to any surprise or as a surprise to any of you, because you were intimately involved in this, but we saw quite a bit of open enrollment and SEP activity during the plan year 2021. We basically were in either SEP or OEP from February through August 15th. And that was a really important time period for Nevadans. So what you can see here by some of this data is that because we had the benefits that came from the American Rescue Plan Act, we saw over 17,000 consumers actively enroll or take action on their application to update it and get access to the enhanced subsidies on the American Rescue Plan, or under the American Rescue Plan. And then we also saw about 51,000 households that we just automatically updated their applications to make sure that they were able to access those enhanced subsidies that were provided through the American Rescue Plan. During that time period, we grew by 7.6% in enrollment. So at the end of August, or at the end of our open enrollment period on August 15th, we had 88,114 enrollees. And over 90% of those consumers were and are receiving financial assistance, thanks in part to the enhancements of the American Rescue Plan. But there's a lot of room to grow. And so I wanted to share this information with you because I think it's, although dated, it's also really relative and important. So back before the pandemic began in 2019, the Gwynn Center conducted a study that showed an estimated 350 to 400,000, or nearly about 14% of Nevada was uninsured. Of those uninsured folks, 37% were thought to be Medicaid or CHIP eligible. So that's a huge chunk. 19% were thought to be exchange eligible with financial assistance. So that means that they were able to be, or they could be on the exchange with financial premium assistance. And that's about 77,000 Nevadans. 12% of those uninsured were thought to be ineligible for the exchange and financial assistance because they had an offer of what was considered affordable employer-sponsored insurance. That means that they were offered insurance through their employer that under the ACA is considered affordable. 27% of those folks were ineligible for the exchange or Medicaid due to immigration status. And so that probably hasn't changed by that much. And then 5% of those folks were ineligible for financial assistance because their income was over 400% of the federal poverty level. So that's about 20,000 folks. And if you think about that, that means there's about 77,000 who were eligible for subsidies prior to the American Rescue Plan who were just simply not accessing that. And then there were about 5% who were eligible for the exchange but were not accessing financial assistance because they weren't eligible because there is that 400% FPL threshold. Well, we all know that that threshold has changed thanks to the American Rescue Plan. So if between the combined 19 and 5%, we've got about 97,000 Nevadans who are likely uninsured and eligible for financial assistance on the exchange. We could potentially double the number of uninsured Nevadans through the exchange this year if we really all went after it. And so I wanted to highlight this for you because I think it shows how much growth and potential for growth there is in the individual market. So you can see that this year has been anything but boring, and the team at Nevada HealthLink has been working fast and furious to implement all of the necessary changes throughout the SEP and the OEP. We have not taken a breath or had any time down. We've been working really hard on making sure that this open enrollment for 22 is geared up and ready to go and set for success. And so it's already time for 22, and we can talk now about what you can expect. So let's start with some important dates. One that already passed, and hopefully all of you are aware of and taking advantage of, is the date of October 1st. That's when we launched our window shopping, and it's available for anonymous plan comparison and open to all Nevadans. So if you visit nevadahealthlink.com today, you can go online and look at all of the different plans that will be available on the exchange for 22. You can take a look at the pricing, and consumers can get an idea of how much financial assistance might be eligible for them based on answers to a few questions and answers that they provide to us. Last week, October 11th through the 14th, we ran our auto renewal job, and we will be dropping notices about renewal by October 27th. Those renewals will be in consumers' inboxes in their portal. And then, of course, the big grand go live is November 1st, and that's when open enrollment begins. And this year, of course, our open enrollment period runs November 1st through January 15th of 2022. Any consumer who enrolls by December 31st, 11:59 p.m. on December 31st, will have a coverage start date of January 1st. And for any consumer who enrolls from January 1st through the 15th, their coverage will be effective February 1st. Any consumer who starts their application by January 15th will be able to complete their enrollment. If you've started your application, you'll be able to complete enrollment between January 16th and the 20th. However, we don't promote that and we don't advertise that. It's just something we want to share with you in case you have any consumers who have started their application but not finished by the 15th. There will be that flexible window for those folks. Let's talk a little bit about renewals. Almost every consumer on the exchange was auto-renewed for plan year 22. The consumers are always renewed into similar and existing plans, or they're into the same plan that they were in previously. If that plan no longer exists, those consumers are crosswalked into a similar plan by the same carrier, and that was done already last week by mid-October. Our consumers, like I said earlier, will be beginning to receive their renewal notifications and then their eligibility notifications in their inboxes by the 27th. We always encourage Nevadans, and hope that you will too, to shop the market. If you're an existing consumer, of course, if you're returning or a new consumer, you have to shop the market, but we always encourage existing consumers to take action and look at all of the new plans that are available. We have new carriers, we have new plans, and there are new rates. So we want to make sure people are looking at the plans and the details and finding something that's right for their individual and family needs. In terms of open enrollment, I hope none of this is a surprise to any of you, but we're very pleased to say that we've added 2 new qualified health plan carriers for plan year 22. And between all 7 of those carriers, there's a record-breaking 126 different qualified health plans, which of course means you all have a lot to learn about the plans that exist. So we're pleased to have Health Plan of Nevada, Silver Summit, Anthem, HMO, and Select Health and Friday Health Plans returning to the exchange for 22. And even more pleased to know that we have 2 new insurers that will be joining us. Aetna Health and Hometown Health will both be available to consumers this year. Of course, we'll have our standard bronze, catastrophic bronze, silver, and gold plans available. The counties of Clark and Nye will have the choice of 86 different plans, and they get to choose from all 7 different carriers this year. 82 plans will be available in Washoe County from Aetna, Hometown Health Plan, HPN, Silver Summit, Anthem, HMO, and Friday. And then 57 plans are available to all of the other different carriers. And those are plans from Hometown Health, Silver Summit, Anthem, and Friday. So as you can see, and for those of you who remember a few years ago when we were looking at having bare counties, we've had significant growth in the plan availability for our more rural counties, and we're very pleased to be able to offer them so many different choices. This year, we'll also have another 20 qualified dental plans from our same 6 returning dental carriers, which includes Alpha, EMI, Delta, Liberty, Best, and Rocky Mountain. And the final average on exchange rate change for plan year 22 is an increase of 4.2%. It's important to note that that's an average increase across all of the returning carriers. So some carriers went down, some went up, and the average is a 4.2% increase. What's even more important for us to get the message out is something that we say every year, and that is that when the rates increase, so does the subsidies. So very few people that are receiving financial assistance will see any kind of increase in their rates as a result of this average rate increase. We are really pleased to bring back or to expand slightly our Navigator grantees we have 7 different Navigator entities across the state, And I'm sorry, that's the same as the year before, but we're very pleased to continue to invest in that important outreach and enrollment counseling. And then really pleased to add an additional broker grantee this year, one in the north. So for a total of 6 different broker grantees across the state. Congratulations to all of you for those successful grants. Now let's talk a little bit about the American Rescue Plan Act. I think most of you are familiar with that, but I want to make sure I expand a little bit on why this is so important for Nevadans. So for those of you who don't know, ARPA extends eligibility. Oh, sorry, I call American Rescue Plan Act ARPA. It's just a little easier to say. And ARPA extends the eligibility for ACA health insurance subsidies to people buying plans on Nevada Health Link and who have incomes over 400%. So like I said, that the lid was blown off of our previous threshold for financial premium assistance. And now we are seeing that people over 400% of the federal poverty level are in fact eligible for subsidies or premium assistance on the exchange. So important for Nevadans to get that message, and hopefully we can make sure that that is our marching orders this year, that we are making sure all Nevadans who are in the individual market know that they probably are eligible for some financial assistance if they connect to Nevada Health Link. The law also increases the amount of financial assistance for people who are at lower incomes. So those folks who are already eligible for financial assistance are now seeing more generous financial assistance thanks to ARPA. Both of those provisions, both of the expansion of over 400% of federal poverty level and then the enhanced subsidies for those who are already eligible for financial assistance, both are temporary. And that's a really important thing for you all to know. They only last for 2 years and end at the end of next plan year. So in December of 2022, unless Congress takes action to extend those. And I will tell you that I spend sleepless nights watching my Twitter feed, hoping that we see a package from Congress pass through soon that expands or at least extends those financial assistance and to Nevadans for at least a good period past 2022. So people up to 150% of the federal poverty level right now under ARPA can get silver plans for 0 premiums and reduced deductibles. So really important information for you as you go about helping people enroll into Plan Year 22 plans. Again, you can get 0 premiums, reduced deductibles if you're in that 150% kind of sweet spot or up to. And you're purchasing a silver plan. Premium tax increases are, increased over 400%, which we talked about. I do want to point out for those of you who did some enrollment during plan year 21, the ARPA allowed for individuals in the state who received any unemployment insurance to get access to $0 premiums through plan year 21. That was only good for 21 and expires at the end of this year. We had about 6,000 Nevadans who were taking advantage of that. And so if you worked with any of those folks, make sure that you're reaching out to them and getting them in the know about shopping and making sure that they're getting a plan that really does meet their financial needs for Plan Year 22. We also know that ARPA extended and gave 100% premium subsidies to many people who qualified for COBRA because of a job loss. So that COBRA premium subsidy ended on September 30th of this year. And the exchange has responded to that by opening up a special enrollment period throughout the duration of this plan year for individuals who lost their premiums or their COBRA coverage. So for those of you who may be working with somebody who lost COBRA, please know that we have an SEP available to those folks and that we encourage them, again, to get actively enrolled for 22. So now let's talk a little bit about our exciting advertising campaign. We are pretty pumped about what our campaign looks like this year. As I mentioned earlier, the exchange contracted with a new vendor for advertising and marketing for this year and for the next 4 years. And so congratulations to the Abbey agency who won that contract and has hit the ground running, starting with all sorts of SEP and important ARPA related messaging right from the get. This year, our open enrollment for 22 campaign theme is check your price. And we've gone through with the Abbey agency and one of their subcontractors and tested all of these concepts with different survey testing groups. So we surveyed and researched and came up with a variety of concepts that were really focused on things like tradition and really kind of engaging and depicting a Hispanic Latino family engaging in family traditions. We will be a being there. So this is another concept that takes the viewer through a journey with a father and a son as that son grows up and has an accident, and the father always making sure that he's covered. We also have a concept that is revolving around health needs. So a couple in their 50s who sees a physical therapist and are pleasantly surprised that their recovery costs are covered through Nevada HealthLink. We have a gender reveal at a hospital where a father is proud to announce to his family that they are not only covered through, or that they not only have had the baby, but they're covered through Nevada HealthLink. We have a super saver concept, so it demonstrates that someone was shocked that they were totally covered by their insurance plan. And a weight lifted concept where someone removes their wallet and a huge weight is lifted with savings from Nevada HealthLink. Like I said, all of these concepts were tested and surveyed and resonated the most with our survey groups. We will always do our traditional ad campaign, and it's going to be more robust than ever. So we'll have outdoor print media and content media on social, paid social, videos. We even have TikTok this year and all sorts of other digital media. So hopefully you're following us on every one of these different platforms and sharing our content. Grassroots sharing is the best way for us to get that message out. So we really appreciate every time you share our content. And we've updated our consumer-facing website. So we've tried to do some great research on how best to get people to navigate to the pages with the fewest clicks on Nevada HealthLink's front page. So hopefully you'll enjoy some of those changes here in the near future. And of course, we always spend a lot of time out with outreach and consumer education and involving our stakeholders, including this meeting. And trying to make sure that we get the message out that our partners can do this education and enrollment via in person or online in our new digital world. We will begin public relations in a little bit more full force. In fact, Janelle Davis is in Las Vegas today, already hitting the streets on our PR campaign, and so we'll be working on that. We have a really great lineup for our press conference on November 1st, which will be on Zoom with Governor Sisolak, with Senate Majority Leader Nicole Cannizzaro, Assemblywoman Wynn, who is the chair of the Assembly Health and Human Services, and Senator Doñate, who has a personal compelling story about health insurance. So we're very excited to be joined with those folks on November 1st. Now I will be quiet and share just a quick clip of our campaign, and so hopefully you can hear it. I'm very proud of this campaign this year. I'm excited to see these ads in production, and you should start seeing them all over the place, I think next week. So we're really looking forward to having that out. And I have just a few more slides. I want to share some information about the challenges for Plan Year 22. And I said this in a different meeting recently, and I think it's worth repeating. In every year that I've been with the exchange, and this will be my 6th open enrollment period with the exchange, we've had some different pressure and some different stress in making sure that things went well. And this year it's kind of a combination of all of that, but I think more than ever, this is a really important year for us to demonstrate how important the American Rescue Plan Act is for Nevadans, and show Congress how important the subsidies and the financial assistance that have been offered through ARPA are in terms of getting people connected to comprehensive and affordable plans. So I'm very enthusiastic about making sure that we get people connected to the subsidies that they're eligible for, and want to let you know that we speak, our national association has been working on collecting data from Plan Year 21 to provide to our congressional delegation, not only in Nevada, but also any of those Congress members who may need further convincing about how important these subsidies are to connecting people. And really primarily, we're looking at some not only great savings for people, but expansion in coverage. And at a national level, that expansion in coverage is really important for some of our older population who were previously maybe paying more because of their age and are seeing a lot of affordability improvements. And so I will stop talking about how important ARPA is, but I will just once more say that, you know, Congress has an opportunity to act to extend that, and we are really hopeful that that happens in the very near future. Another challenge this year is that kind of persistent and continued pandemic, and just the limitations that we've all sort of turned into opportunities throughout the last 20-some months, making sure that we're able to accommodate enrollments and questions and counseling for our consumers kind of in any way, shape, or form that they need it, whether it's telephone or Zoom, what have you. We're there for Nevadans. I want to share with you something that is a constant moving target for us right now, but important for all of you to know. When the Families First Coronavirus Act was passed, the Congress established a public health emergency. And that public health emergency has gone on for the duration of the pandemic. And it requires that Medicaid agencies do provide what's called continuous coverage. So basically, they are not redetermining eligibility during the time that this public health emergency has been established. So many people have been enrolled statically in their Medicaid plan without having to go through a redetermination process because of the declared public health emergency. The state has also enjoyed an enhanced funding, or FMAP, as a result of that public health emergency declaration. And so we are watching closely and working coordinated with our sister agencies in the governor's office, the unwinding of that declared public health emergency and the kind of rippling consequences from that. So when the Secretary of Health and Human Services signed an extension on the deadline of that emergency, and now it is extended through January 16th of 21. We do anticipate or hope that we will maybe see another extension that will take us out of the winter periods, but that is not at all guaranteed. And that means that we will continue to benefit from that enhanced funding for our Medicaid recipients through March of 22. But what that means is that as soon as that public health emergency is declared over, Medicaid, or the Division of Welfare and Supportive Services, will begin to redetermine hundreds of thousands of applications. We saw over 30% increase in our Medicaid enrollment throughout the last 20 months. And so it's a significant undertaking. It's a significant amount of people who are going to be redetermined, and very likely that some of them are going to be deemed ineligible for a variety of different reasons. One of the reasons that's super important to the exchange is that people have, which is a good life circumstance, their income has enhanced to the point, or increased to the point, where they're no longer eligible for Medicaid, but are potentially eligible for the exchange and subsidies. So that sweet spot is really what we're trying to figure out, how best to manage that churn and make sure that we're connecting those people to the subsidies available to them on Nevada Health Link. There's another portion of those folks who will be just almost impossible to get a hold of. And that's where I have a call to action for all of you. If you know people who are currently in Medicaid, please make sure that they take the time right now to update their contact information with the Division of Welfare and Supportive Services. We need your emails, we need your phone numbers, and we need your most current address so that we can get a hold of you during that redetermination time period and make sure to offer you help and to make sure that we can redetermine you either eligible for Medicaid or help you get connected to the exchange. So again, please help make sure that your anybody you know has updated contact information with Medicaid. Finally, just two more things that are kind of challenges for 22. I want to point out that as in every year, we see an uptick, and I can see it already when I Google Nevada Health Link, in misleading websites. So websites that target people and try to convince them that they say things like Obamacare, that they misrepresent themselves, or they mislead people into believing that they're buying something through the exchange. We work really hard and spend a lot of our resources and time trying to be the first link that you get when you search for Nevada Health Insurance or Nevada Health Link. But it is a kind of never-ending game of tag. And I wanted to point out that we need to make sure people are going only to NevadaHealthLink.com to get connected. And then finally, I mentioned earlier that we have just been working really hard trying to get information and the word out to people who lost their COBRA premiums because the ARPA premium subsidies went away in September. We would really appreciate your assistance in getting that information out to people you may know or work with, that there is an SEP available. And then finally, I want to just share that the state is just not at all bored in terms of managing new projects with respect to healthcare. This last legislative session was super busy with health endeavors. And so, like I mentioned earlier, there's the unwinding of the public health emergency. And again, we really need your support in getting people's contact information updated with that Division of Welfare and Supportive Services. The exchange is working closely with DWSS as they begin to send redetermination notices. And we are putting our own flyer into the standard mailers that DWSS has. We also are working and reaching out with to DETR, or the Department of Employment Training and Rehabilitation, seeing what we can do to put our flyers and information into their outgoing mail. They tend to keep very accurate information on consumers' addresses and phone numbers and emails. So we're working with them to see what we can do to leverage that information and get connected to those people. Many of you know that Senate Bill 420, also known as the public option, passed this last legislative session. So we are coordinating with the Department of Health and Human Services on any necessary waivers for that. And then Assembly Bill 432 also passed this last legislative session. Oh, I should go back, I'm sorry. Senate Bill 420 will be effective, or those plans are supposed to, under statute, be available on January 1st of 2026. So there's a good couple of years before that happens. And then in terms of Assembly Bill 432, that bill requires and makes the Silver State Health Insurance Exchange an automatic voter registration organization, similar to what happened with the DMV a few years ago. We are now required to be an automatic voter registration effective 2024. There are some business processes and logic that has to be built in order to successfully achieve that status. So we are currently working on that right now. And with that, I just want to once again just appreciate all of you and the work that you do to help us get the word out and help get Nevada HealthLink's brand and imaging out there. We need you to help us engage those returning consumers and making sure that they're looking at what's available this year. Like I said, there's so many different changes and opportunities, so we want them to actively shop. We also want to make sure that their information on their application is up to date, so helping them make sure that that information is accurate. And then we also need your help finding all of those uninsured people. So that 97,000 folks that I mentioned earlier, we need your help to connect them to the exchange. Help us find them, help us connect them, help us make sure they understand that there are very likely financial assistance available to them. And also we want your help to share our good news. So there's great news about rates, great news about affordability. Please follow us on all of our different social media. Please share our content. Please visit our website. We have all sorts of marketing tools and assets available for you to just quickly download and share. And we always, in every interview I ever have, encourage people to work with enrollment professionals, whether that's a broker or a navigator. We encourage people to work with a professional because insurance can be confusing. And we want to make sure that you are working with a professional who can help you find a plan that's right for your individual needs. And finally, I say it every year, but every year it's true. Don't just help someone enroll, make sure they pay that binder payment, that they effectuate their plan, so they don't end up surprised sometime when they go to the doctor and find out that they're not actually insured. You have to effectuate your payment or your plan. So I will leave up our slide about our open enrollment. This phone number and this email is available to our brokers and navigators. And so we hope that you will reach out direct to our call center and ask any questions via email. And please help us get the word out about open enrollment. And Connie, maybe you can help me look at the questions that are in the chat and I can answer some.
Yes, I am looking at those now. Katie has done a great job of answering them as we go. So thank you, Katie. I'll try to read through the ones that do not have an answer yet. One notes a question about if somebody was 65 years or older and they just arrived from a foreign country with a green card, what insurance options would be available for them?
That's a great question. And I think something that we want to make sure to get right. So I'll make sure we answer that in our Q&A that goes out via email.
Wonderful. And then another question was sent noting that a letter was sent to all renewal clients today and the broker of record wasn't referenced in that. So they were wondering if there was a way that that letter could be updated and modified to reference the broker in the renewal note.
That's a great question that I'm also going to need to look into. So I assume that we have the name of that individual and we can go take a peek.
Yes.
And we'll get back to that person. Thank you.
Okay. Thank you. Okay. Somebody asked when the FPL chart for 2020 will be available.
I believe we have updated that on our website, and we'll make sure to include a link to that when we send out our Q&A.
Perfect. And then a question was asked for the PII form on the website. So we will also send that out in the Q&A afterward in the chat. A question was asked whether a consumer can review and change their plan to renew it now, or if they have to wait until November 1st.
Oh, you do have to wait till November 1st, but if they just want to stay in the same plan, we are actively doing all of that renewal activity right now. So on November 1st, you'll see that they were renewed probably into that same plan or something very similar.
Wonderful. To renew for plan year 2022, a consumer will have to update their income for 2022. Is that correct?
We always encourage people to make sure that that information in your application and your income is accurate. But when we do our renewal job, we base it on what you previously provided. So if that's changed, make sure you change that.
There was a question about if agencies need more navigators for the current enrollment period.
We have 7 different entities across the state who are doing this work. I think there are 39 different exchange enrollment facilitators that are employed throughout those 7 different organizations. And you can find out more information about them on our website.
Great, thank you. Will the call center be open 7 days a week during the enrollment period?
We are actively, yes, they will be open. There will be some extended hours, and I will make sure that that information is included in our Q&A and in tomorrow's presentation. I apologize, I don't have that right in front of me.
No worries. Someone asks if an illegal resident can get insurance through the marketplace.
So residents that don't have a documented status are unable to get qualified health plan premium assistance.
Okay, sorry, trying to go through.
I'm looking at some of these too, and I see, thank you so much, Athena, for helping to answer some of these questions.
Yes.
Live. I appreciate that. And somebody asked about having flyers and put in our e-newsletter. And we absolutely would love to share our content with you. So we'll make sure to include in our newsletters the website that you can download all of our marketing and branding content. All right.
There's a question on here. Oh, sorry, Heather. I was just saying, if consumer calls Nevada HealthLink and they have a broker on file, will Nevada HealthLink direct them to their broker/member?
Yes, unless it's something very simple like they want to log in or they've forgotten their password. Of course, we help them with that, but we always make sure that they know that there is a broker affiliated with their record and provide that content and that, or excuse me, that contact information.
There was a question if there is a 5-day grace period. So if a consumer applies on the 15th of January, but don't have it completed, do they have the grace period until the 20th of January?
Yes, correct. We, like I said, we don't advertise that, but anybody who has started their application by the 15th will be able to finish their enrollment by January 20th.
Wonderful.
Another one on here. I think some are getting sent directly to me. Sorry, Connie. On here it says you referenced that the rate change for plan year 2022 is approximately 4.2%. Consumers have contacted me today saying their APTC is going down for 2022. The window shopping tool confirms this. Do you know why that is?
Well, it's important to remember that that's an average rate increase. So when you see any kind of fluctuations in APTC, you need to go specifically to that plan. There's possible that that plan actually went and became less expensive for plan year 22, and thus the APTC was decreased. But again, you can call our call center and we can help you walk through the specifics. All right. I think what we'll do now, because we're nearing the end of the hour, we will make sure that we provide answers to any questions that were not answered online or via live in a Q&A, and we'll make sure we go back and copy and answer all of your questions that I even answered online. So again, please make sure if you have questions, call our 1-800-547-8156 for our broker navigator line. That's just for you all. And we look forward to a successful open enrollment period. Thanks so much for joining us today, everybody. Have a great one.